priority code will be the treatment directed, right? Wherever the treatment is going on, that would be your first code. If treatment is going on the secondary cancer, code secondary cancer first. If treatment is going on the primary cancer first, code primary cancer first. That is one guideline. That is very important, right? Second guideline which we need to remember is about sequencing of a complication. Complication later. Complication. So if just remember all the complication, whether it's related with the cancer or related with the therapy. First code is a complication code. Second code will be cancer and so on. But the only exception is anemia, that too when it is associated with the cancer, not with the treatment. Okay? Anemia associated with anemia is because of the treatment. Code anemia first. Okay? Anemia is because of the cancer. Code cancer first. Only one exception remaining everywhere, complication first. And then others are very easy one. For the history, we have a Z85 series code, right? And what else was a? Do you have any bullet points? Did you make a note on that? That is of chapter 4, chapter 2, cancer code. For the treatment, if the patient is coming for treatment, we have a encounter for chemotherapy, encounter for radiation therapy code, right? That would be first. So see all the, if you remember the previous guideline, it will come again. Like what we remember about the Z series code or Z series code, that those Z series code, if it is starting with the encounter or screening word, it will always come first, right? No matter what. If it is cancer also and patient is coming for chemotherapy, code chemotherapy code first. Encounter for chemotherapy, right? That was we have seen in the first class, but again we are revising this one. So if the patient is coming for encounter for chemotherapy, radiation therapy, that would be your first listed code. Good. Then management or dehydration and all this. Easy one. Remission until it is documented, don't code it. For transplanted organ, we have a separate code because that is not our original organ, right? It is a transplanted one. Then chapter number 4, diabetes. The very first guideline for diabetes, what you need to remember is, if it is not documented, the type is not documented. The diabetes type, they have not clearly given that is what is the type 1, type 2, what is it? Always consider what? Type 2. Okay? Yes, the code series is for type 2 is a 1 plus 1. Sir. E11. Okay, E for diabetes. Okay, 11. 1 plus 1, 2. Type 2. Okay. Z79.4. When we cannot code. Give me. Three scenarios we have.
Yeah, type 1 and gestational diabetes and short term.
Good.
Short term.
You. See online people, how they are giving answer. I asked one, they kept 3. Yes, 3 scenarios. First, type 1. Second, gestational. Third, short term period. Suppose patient is admitted in a hospital for 10 days. Okay. For some cardiac related issue. He got heart attack. Cardiac means अच्छा वाला. He got heart attack. He was admitted in a hospital for 15 days. In between, third, fourth day, his insulin was so increased. I mean, sugar. His sugar level is so high. Then they started giving insulin for 5 days continuously to lower down the sugar value. Can I quote long-term use of insulin code? This 79.4. Why? It's a correct. It's a short-term stay, short-term use. Code itself says long-term use. Remember? So this will come under third category. Short-term use you can't code. Good? Okay. Combination code for the diabetes. Yes, we have many other manifestation. All the manifestation mostly related with the diabetes is we have a combo code. Okay. So you can code combination code. Okay. That combination code you need to check in a tabular list and confirm whether we need to code, where we need additional codes or not. Right? What we have seen here, diabetes plus skin ulcer, foot ulcer, 11.61, which says code L series code additionally. Similar way, E11.22, diabetes plus CKD, which need additional code for the stage of a CKD. And that all things are there in your tabular list. If you'll go to the E11.222, you will get it. Okay. Then malfunction of a insulin pump, sometime over secretion, sometime less. Okay. So less secretion, always remember 3 code we have to code. First code will say about the complication of any device. What is the complication? Then underdose of an insulin pump. That will be your second code. Third code is a type of a diabetes. Okay. Similar way for overdose, first is a complication, second is the poisoning, and third one is a type of a diabetes code. Fourth one is a complication if there is any. Good. What else we have in a diabetes? Secondary diabetes. E08, E09, E13. E08, we have a certain disease there. 6 diseases are documented there, right? So if diabetes is because of those diseases, then you have to code E08. If diabetes is because of some drugs and chemicals, you will code E09. If apart from these two, any other condition which cause diabetes, you will code E13. Good? Any other disease, other specified condition. Because we have three things, 3 code for secondary diabetes. E08, E09, E13. E08 is for 6 reasons. We have particularly given this 6 reasons. Okay. E09 is for drug and cosmetic. Sorry, not drug and chemicals. And then E13 is for any other reason. Any other reason which is causing diabetes. Good? Okay. Pressure ulcer. How you will code pressure ulcer if it is 2 stages in the admission? What is the guideline?
Admission code, and if any highest code is there, you have to code along with that.
Proactive. Okay. 2 codes we have to code here. First code is for at the time of admission, what was the stage? Second code will be what was the highest stage during this hospitalization. Done? Done this is. So this hypertension, I will start from that class. Okay, I have to write down many things there. Or you can join. I'll wait. That would be done. If you can't see screen, you can just join with the mobile. As of now. Okay. Chapter number 15. The important chapter, very important chapter. And very important chapter because it is related with the pregnancy. Okay. Now, what was the first guideline of a chapter number 15 which we have seen in all the chapters? Chapter 15 is for OB series. OB is for pregnancy. Correct. So, OB code is always superseding all other chapters. Chapter 15 code will always supersede all other chapters. It means if lady is pregnant, anything happens. If she is sneezing 10 times, that is also complication. That's a joke. But anything happens with the lady, pregnant lady, it is considered as a complication of a pregnancy. We will go O series code first. That is our first guideline. Okay? Sequencing priority will always be first is the OB code. Later on, you can put anything. Patient have a HIV AIDS, O98.7. You remember? O98.7 deaths. And then we have a whether it's a Z21 or B20. And then we will follow the HIV guideline. But the first code will be O series code. Okay? This code is only and only for maternal record. What is the second guideline? It is only used for maternal record. Suppose a lady coming for delivery, she delivered a baby. Baby is now indivisible identity. Okay, you cannot put any condition which is baby's condition, newborn condition with O series code. This is only and only for mother. We have P series code for babies. Newborn code, we have a P series code. If lady is pregnant and any complication we found with the unborn baby, fetus, that you can put O series code. Because that time you cannot put P series code. Now. You understood my concept? If baby is not born yet, the baby's complication, baby's means fetus complication will be considered as a mother complication. Before delivery. Before delivery. Like baby in a fetus have some what can fetus have? Position issue, right? Breathing issue, heart rate. Baby's fetus heart rate is not accurate. It is problem with the fetus, but we can code as a O series code because for fetus you don't have any code, any other chapter code. It will be included in a OB series. But once baby delivered, now baby is separate, mother is separate. For baby P series, for mother O series. Achha. For mother we have a this OB series is for pregnancy, delivery, and after delivery also, which is known as a postpartum period. Many of you know that postpartum. Postpartum period is a after delivery till next 6 weeks. Okay? Suppose baby delivered today. Today is a what? What is the date? 29th of December. Okay? So next 6 weeks, lady will be considered as a postpartum period. It means till the February 2nd week. Because that time, this postpartum period, the lady's body will recover from pregnancy. Because uterus has inflated. Uterus size is very small, but baby was staying there for the 9 months. It was gradually increasing like a balloon. Now suddenly baby came out. Uterus is very now not in a proper shape now. Same with the genital organs. It's not a proper shape. So this 6 week time, lady's body need to recover. Okay, that's why I say, she just delivered baby. Don't give any work to them. Okay, let them take rest. Correct, na? So that is known as a postpartum period. Can I code O series code for postpartum? Yes, I can code, because that is also related with the pregnancy only. Clear? Okay. Now the third guideline says final character is for trimesters. You know trimester? Trimester, month. 3-month period. Pregnancy is a 9-month period. Okay. But here also if you see report, any report with the pregnant ladies, they will not mention month. They will say weeks. In a general language only we say which month is it? 6 months, 7 months. But in medicine, in a doctor's language, they will not talk about the month. They will talk always about the weeks. A 7th week, 8th week, 14th week, 20th week, right? So trimester is about 3 months. So please make a note on that. Those who already know, it's well and good. Others, please make a note for trimester. 0 days till less than 14 days. 14 weeks, sorry. 14 weeks is known as the first trimester. 0 to less than 14 weeks. 0 to less than 14 weeks. Sir. 0 to less than 14 weeks. Okay? Less than 14 weeks. If it is exact 14 weeks, it is coming on the second trimester. 14 weeks till less than 28 weeks is known as a second trimester. And 28 weeks till delivery, it's a third trimester. Let's move there. Okay, I can use at least projector. Guys, give me 2 minutes. We are moving to different room. What we have seen here, first thing is for mother record. This is only for maternal record. It's only for maternal record, and we will always prioritize these codes. Okay, O series code will always be first listed code. Final character is for trimester. There are so many codes. So many means out of like a in OB series almost like a 70% codes. Or final character will tell you about the trimesters. Now my job start to highlight the things. Okay. So final character indicates the trimesters in a pregnancy. The time frame from the trimesters are indicated at the beginning of the chapters. That's what I told you. 0 to 14, less than 14 weeks is the first trimester. Okay. Now, selection of a trimester for an inpatient admission that is for more than one trimester. Chalo. Suppose lady is admitted in a first trimester, 13 weeks, 4 days. Okay, 13 weeks, 4 days, lady is admitted and discharged on the 14 weeks, 3 days. Okay, 13 weeks, 4 days she was admitted because of some complication. Today she is getting discharged. Today is a 14 weeks, 2 days. What is that? It's second trimester. She was admitted in the first trimester, right? Today what you will code? For her discharge summary, will you code first trimester, second trimester?
Second trimester.
Logically, we should code second, right? Here, yeah. Again, here opposite now. We have to code first trimester, even today also. Because, series, In instance when the patient is admitted to the hospital for complication of the pregnancy during one trimester and remains in the hospital, okay, and remains in the hospital into the subsequent trimester, the trimester character for the antepartum complication should be assigned on the basis of the trimester when the complication developed, not the trimester of the discharge. Good now. So see, normal so we know, the concept we know, right? What usually, this is a other thing that you can remember. Unspecified trimester, we have a separate code for that. If they are not specifying number of weeks or trimester, we can code unspecified trimester on that. Then few codes have seventh character which talks about the fetus complication. Okay, this is for fetus. The code also ranges here 31, 32, 33, 35, 36, 40, 41, 60, 64, 69. These are the some code ranges. In that final character or the seventh character, we talk about the fetus. Okay, this is for multiple pregnancy mostly. And this code is for fetus complication. As I told you, fetus have a heart rate problem. Then it will come under this category. So suppose if there are twins, lady is a twin pregnancy, then which fetus have a heart problem? Both fetus or only one fetus? So what happens whenever they will scan, they will do scanning on the twin during pregnancy, and if it is found twins or triplets or multiple, okay, they will give fetus numbers 1, 2, 3. I don't know how they recognize because fetus are still moving, but they give number fetus 1, fetus 2, fetus 3. So which fetus have a complication? For that, remember this one. This is very important now. When I can use seventh character as 0. 0 when there is only single fetus. I'll 1 second. I'll just show you this code O31 so that you will see why I'm telling you this we need to remember.
Hello, sir.
Yes.
Sir, can you hear?
Yeah.
So they identify with the prop, and when they place, there will be a prop which is mentioned for fetus 1 and fetus 2, sir.
Okay.
So in the trace, there will be 2 heart rates.
Okay. So in that, so if it is a multiple pregnancy, then also they can identify number 1, number 2.
Yes.
Okay. So see, we got an expert opinion then. Okay. Now let's see O31. Okay. O31 series. Let's come. Complication specified of a multiple gestation. In that, seventh character is 1 to 9. Here you can see, no? So if it is 7th character is 0, it means it's a not applicable or unspecified. And then we have a fetus 1, fetus 2, fetus 3, fetus 4, fetus 5, and 9th one is the other fetus. They could not identify them. This one. So when I will code character 0, when this is single gestation. Why I'm telling you now? Because for single gestation people use 1, means by mistake. Okay. In Optum we have one project which usually come on the month of February till February to May. We have one project where there only we code pregnancy code. So remaining 9-10 months we don't have a project which is for pregnancy code. So people usually don't know the guideline of pregnancy, and they do the most common mistake is if it is the first one fetus, single gestation, they do last character as a 1. You say 7th character is a number of fetus. It's not number of fetus. It's identification of a fetus. Okay. If it is twins pregnancy, in that they are saying the first fetus have problem, then it will be 1. Okay. If second fetus have problem, then 2. Correct. If it is single gestation, then no need to identify now number 1, number 2. It's a 0 only. So here you can use 0 for a single gestation, and when the documentation in the record is insufficient to determine the fetus affected and it is not possible to obtain clarification. When the documentation record is insufficient, or when it is possibly, if it is not possible to clinically determine which fetus is affected, in that time also you will quote 0. See, here it is not documented for single gestation or something. Okay, so when any situation, if you are coming to this kind of a code where 7 characters is identifying the number of fetus, okay, here you will not see this, but you have to recall that I have a guideline in a chapter that 0 series 0 is for single gestation. Okay, so done then. Complete week of gestation. This is not a guideline. This is just a your understanding. What is the first trimester? 0 to
14. Less than 14.
14 weeks or less than 14 weeks.
Less
Okay.
than 14.
13 weeks, 6 days. Can we consider it as 14 week? 1 day only, na? No? Boys?
Yes.
Correct. No. We can't. This is 13 weeks, 6 days. It's the first trimester, boss. Tomorrow, it will be 14th week. That is second trimester. You can't give you can't give linearity or just 1 day. Take it second trimester. No. That is your complete one. Okay? Okay. Now, imagine in your home there is a lady who is pregnant. Okay, it may be anyone, your aunt, your sister, your anyone. Okay, now she is going for a routine checkup. You know, every month they have to go for a routine checkup. Sometimes they will go do the routine checkup includes ultrasounds also, scans, right? Sometimes vaccines, sometimes normal report, normal checkup. That's all. So if patient is coming for a normal pregnancy, then we have a code Z34. Now, what do you mean by normal pregnancy? First of all, what is normal? What I can call normal?
Without any complications.
Without any complication, very good. If patient does not have a complication but having twin pregnancy, will it be normal? No complication. What do you think? Multiple pregnancy will always be complication. Although patient does not feel anything, but boss, there is a one space. Okay, it is a, just imagine if you are staying in a very small room. Okay, you never visited Mumbai. There you can feel what is a small room means. Okay, suppose we have one room. There you and your friend stay. You are adjusting. It's a very small room. Suddenly 2 more friends came to your room. Why? I want to just come to see Mumbai. I will stay in your home for 5 days. Although they are not bothering you, but it is little complicated, right? You 2 people can were adjusting anyhow. 2 more people came. They're not bothering you, but it's a complication. Same thing. We have one uterus. In that one baby can fit. Now suddenly multiple pregnancy, 2, 3. They're not creating any complication. Because of that, patient does not have any issue. But it is considered as a complication. Okay? It is complication. So normal pregnancy means patient have a single gestation and does not have any complication. Can I code any O series code with Z34? What do you feel? What is O series code? Pregnancy? What? Pregnancy status? No, no. Then when I will code O series code? When patient have that is O98.7. All O series code, all chapter 15 code is what? For pregnancy related? For pregnancy related?
And childbirth.
Pregnancy related complication, no. Why we have a O series code? Is there is any complication? Then only O series code. I cannot say that lady is pregnant. O series code. Nahin. That is Z series code. That is her status. Status pregnant. Z series code. If there is any complication, then only O series code. Can I code any O series code with Z34?
No.
No. Because it is normal.
Normal, yes.
Right? If it is not normal, I cannot code Z34. Z34 says for normal pregnancy. And we are not doing any treatment. See, supervision of a normal pregnancy. It's like you are a top performer in your team. Okay? In your office, you are a top performer. Then your manager will not ask many things to you. Anyhow, you will complete your task. He will just supervise. That work is done. Yes, about done. Fine, good. But who is underperformer? They will keep do this one. This is today's deadline. 2 o'clock, give me one report, intermediate report. After lunch, meet me. We'll have meeting. No. If it is a top performer, no, nothing, no treatment. Just supervise needed. Same thing. For normal pregnancy, supervision. Everything is fine? Yes, fine. All good. Go. Fine? Z34. Remember, if you are getting any O series code along with Z34, option eliminated. Straight away. See, these codes should not be used in conjunction with the chapter 15. And this G34 is not chapter 15 code. Although it's a pregnancy related, but it's coming under chapter number 21. Right? Last chapter. 22 chapter. Good? So no 15 chapter code will be coded along with the G34. Now, what is the supervision of a high risk pregnancy? O09. This is high risk pregnancy. High risk pregnancy is what? If there is a severe complication. Severe complication means if patient had a history of a miscarriage, if patient have a elderly age or young age. Okay? If lady is 45-year-old, high risk pregnancy, although she does not have a complication, but it's a elderly age, right? That is a O09. So, for complication during the labor and delivery episode or result of high risk pregnancy, assign the applicable code chapter 15. So, if there are no complication during the labor or delivery, assign O08 and counter for the full term delivery. I will come to this code. O09 is the supervision of a high risk pregnancy. O80 is the encounter for full term uncomplicated delivery, which is for Z34. We'll come on that. Okay, Siri, if a lady is does not have any complication and coming only for supervision, what we will call Z34. Correct. If the same lady come for delivery, no complication, delivery done. She just got a little labor pain. Okay, that to normal labor pain. We waited for a few hours, and she delivered a healthy baby, single, one fetus, single baby, healthy, delivered vaginally, normal delivery. That time you will code O80. O80.
Can you please repeat once again, sir?
Okay. See, O8 Z34 is for encounter for supervision of an normal pregnancy, right? Uncomplicated pregnancy. The same lady, if she is coming to deliver a baby, and the delivery was done without any complication, then O80. Good.
Yes, sir.
Z34 is for office OPD visit. Okay, just a consultation. And O80 is a delivery code for the same lady who does not have any complication. If a lady have a high risk, then what is the high risk? That we can quote from the chapter number 15. For O09, supervision of a high risk pregnancy, you can code multiple O series code. When a delivery occurred, not delivery occurred, we have a other code for that. Outcome of a delivery. Now, suppose lady is in a hospital for delivery. It's a delivery room. Now, as a family member, you just heard a cry. Cry means baby's cry. You are very happy now. A baby born. Suddenly one nurse will come. She will give you good news. Baby boy, baby girl, single, multiple, what is that? That good news is a Z37. Outcome of a delivery. So let me come to that code. I'll show you. That is only for outcome of delivery, not even for baby also. क्या हुआ है? वो है वो सिंगल बच्चा डबल बच्चा. Okay. Z 37.
ଯିବା ଜଣ ଘର କତିକି ଖାଇତେ ଡାକିଛନ୍ତି. ଜଣ ଘର କତିକି ଯିବା ନିମନ୍ତ୍ରଣ.
Is 37. Don't we have? Chapter 15 though, that is O series code. No? I'm talking about Z series code. Z30, what is that? Z37.
Single live birth, sir. Z37.
That is single live birth. Where you got it?
From Z series 21 chapter.
That's what I'm searching now. I want to show you because we have a different codes on that. Single born, okay, single live born,
single stillbirth, twin, both live born.
One single
stillbirth.
Where we
twin,
have?
both stillbirth. Twins, one live birth, one stillbirth.
Outcome of delivery, okay. There is one, but it is not complete code now. We have Z37.0, Z37.1, Z37.2. That's what I'm searching. Can you see in your book? I'm not getting it here. 37 is not there. Okay, leave it then. Okay, you can just check the Z37 outcome of delivery code. You will get the multiple. No book. You didn't get it. Check it, no. Okay. So we have a different outcome of delivery. Single live born, single stillborn. Okay, bad news wala. Baby born before birth only, baby dead. That is stillborn. Twins live born. Twins one live born, one stillborn. Twins, both stillborn. Like this, we have a different codes on a 337 code. This you will code along with the delivery code. Okay. Now, there are certain conditions which may develop during pregnancy. Okay. And may be a pre-existing condition. Like there is a pregnancy-induced hypertension, high BP. So, that if it is a pregnancy-induced, okay, lady is pregnant, before pregnancy, she was not having high BP problem, hypertension problem. After pregnancy only or during pregnancy only, she developed hypertension. So clinically, it will be considered as a pregnancy-induced hypertension. Okay, same like a diabetes also. Patient does not have a diabetes earlier, but during pregnancy she developed diabetes. It will be considered as a pregnancy-induced diabetic mellitus or gestational diabetes mellitus, gestational hypertension. Pre-existing means patient had diabetes, patient has hypertension, she got pregnant. So we have a different code for this. So if it is a pre-existing hypertension, O10, I10 is a code for hypertension. O10 is for pre-existing hypertension in a pregnancy. See, this is description of a O10. Pre-existing hypertension complicating pregnancy, complicating childbirth, and puerperium. This is postpartum only. Code from the category O35, O36. O35 is for, see, this is description, okay? Maternal care for known or suspected fetal abnormality and damage. And O36 is a maternal care for other fetal problem. This is fetus issue, fetus problem. O35, even though we are not confirmed, we are just suspecting, then also we can code O35 code, which says suspected or known fetal issue. Known or suspected fetal abnormality. This you can code are assigned only when the fetal condition is actually responsible for modifying the management of the mother. By requiring diagnosis study, additional observation, special care. This is not for you. If the doctor is documented, this is a fetal issue which is complicated in pregnancy. You will code it. So there is no such guideline. It is just that we have a code for that. Later point of time in the paragraph, they are saying you don't judge that fetal have problem and you will code complicating. No. Doctor should tell us that this is a fetal problem which is complicating pregnancy. We can code it. Okay. Okay. HIV infection in pregnancy. We did this guideline before. Chapter number 1, O98.7, first listed code. Later on, we can go with the B20 or G21. Right? And later on, we can follow the guideline for HIV related illness. If I say patient have a HIV related TB and patient is pregnant, so O98.7, again the trimester numbers, okay, then B20 and then TB code, tuberculosis code. How I am arranging this order? Because as per the chapter number 15 guideline, O98 later on B20. Why B20? Why not TB? Because in the first chapter we got to know if any condition is related with the HIV or AIDS, that related condition will come after B20. Remember the chapter number first guideline. So we are combining two chapters guideline here. 098.7 plus means after that B20, then after that tuberculosis code. Okay. Diabetes in a pregnancy. So patient if have a pre-existing diabetes. Pre-existing patient had diabetes and then got pregnant. What kind of diabetes it is? Type 1, type 2 or secondary?
Think, let me know. Yeah, what about? Yes, what it will be? Okay, why type 1? Why type 2? Type 1, it means it's a juvenile and
IDDM, right?
they should document it is the IDDM, then only it's a type 1.
Because it develops in a very early age. Very early means 5, 7, 8-year baby. Maybe ladies develop later. Now see what happened in a like 10 years before. If my age or your age, people get diabetes, they will say, "Hey, this is type 1 diabetes only." Because this is not our age to get diabetes. Right? But nowadays it is very common. Even though 30-year-old people also get type 2 diabetes. It's very common nowadays because of our lifestyle. It's common.
Okay. So if it is pre-existing, type 2 always, or type 1 always, or secondary always, or it may be anything.
It may be anything. How? Means they will specify in a question. If they are not specifying, it's a type 2 by default. But if they will say patient had diabetes type 1 from the childhood, now she got pregnant.
It's a juvenile, but we have to code 424 series for pre-existing diabetes mellitus. Okay, 424 is a code series for pre-existing diabetes mellitus. Second code will come type of diabetes, whether it's a type 1, type 2 or secondary, E08, E09 or E13.
See, you didn't read this one. See, who is diabetic should be assigned category O24, and then diabetes mellitus pregnancy perfusion first, followed by the appropriate diabetes code. See,
E08 to E13.
first code will be O24, second code will be E08, E09, E10, E11 or E13 based on the type of diabetes. Correct, na? If I say before pregnancy only, the lady's pancreas was removed, then you cannot say it's a type 2 diabetes. It's a secondary diabetes,
E13 series. Yesterday we have seen, right? Status post pancreatectomy. Can we use long-term insulin code and oral hypoglycemic code along with O24 series code? Yes, you can code, but you have to follow
chapter number 4 guideline also.
Suppose the type
1 diabetes.
lady is pregnant, lady is taking insulin. You can't code insulin code because the type 1 diabetes. Right? If it is type 2, lady is taking long-term insulin, just code it. What we have seen yesterday, same thing. The only additional thing here is the first code should be O24.
That's all. See, pre-existing type 1 diabetes mellitus in a pregnancy. First trimester. See the last character. Last character is a 1, first trimester. Last character is a 2, second trimester. Last character is a 3, third trimester. Last character is a 9, unspecified trimesters. O24.02 during childbirth. O24.03 puerperium. Clear? Pre-existing type 2 diabetes mellitus. O24.1 wala. Okay, so this is pre-existing diabetes mellitus. What about gestational diabetes, pregnancy-induced diabetes mellitus? What is the code range? Code range is the O24.4. O24.4 is a gestational diabetes mellitus. It means pregnancy-induced diabetes mellitus. Can I code insulin code here if lady is taking a long-term insulin? Can I code Z79.4 long-term insulin code along with O24.4?
No.
What? In the beginning of a class only you told, right? 3 condition you cannot code insulin code.
Yes.
Type 1, gestational and short-term use. Why we cannot code here? Because here you will find combo code for that. See, O24.410. Gestational diabetes in a pregnancy, diet control. O24.414. Gestational diabetes mellitus in a insulin control. O24.415. Controlled by oral hypoglycemic drugs. So no need to code. No need to code Z79.4 for long-term use of insulin or Z79.84 long-term oral hypoglycemic drugs. No need. Okay? Should not be assigned with O24.4. Code Z79.4, Z79.84, 79.85 should not be assigned with the O24.4 series code. Good? Sepsis or septic shock. We have to go with the first O series code and follow chapter 1 guideline. That's it. See, when assigning a chapter 15 code for sepsis, complicating abortion, pregnancy, childbirth, puerperium, a code from the specific type of infection should be assigned as an additional diagnosis. Like if severe sepsis is there, you have to code R65.2 series code. Puerperial sepsis, O85. Should be assigned with the secondary code of identifying the causal organism. And along with that, you cannot code A40 or A41 series code because A40 and A41 series code is also for sepsis. Already you told that is a puerperial sepsis. No need to tell again it's a sepsis by category A41. Good? Okay. What if pregnant lady is going to any party
alcohol consumption. Is it problem with the pregnancy? Yes. So alcohol, tobacco, drugs. That drugs, okay? It's not a pregnancy folic acid or something. That is a drugs, narcotic drugs. Permanently gone. So yes, that would be considered as a complication, and you will going to code 099.3 series code. 31 for alcohol, 33 for smoking or tobacco, and 32 for drugs. Along with that, you can code chapter number 5 code, whether it's a use, abuse, or dependence also. Okay. Yesterday we have seen, right? Use, abuse, dependence. So that also you can code after 099.3 series code. See, F10 for alcohol, you can code a secondary code from the category F10. Similar way, secondary code from F17 for nicotine dependence. Secondary code for F11 to F16, F18 to F19. That is for drugs. What kind of drugs you like? Cannabis, opium, heroin, cocaine, marijuana, everything we have a code. Okay? So this is also complication. What if a lady who is pregnant was poisoned? Poison, it means not actual poison wala poison. If she is taking a normal drug, paracetamol also, and she developed some adverse effect because of the paracetamol, that will also be considered as a poisoning of paracetamol or adverse effect of paracetamol. So in such case, again, that is a complication, and we have a O9A. Okay, this is for injury also. O9A.2 injury, poisoning, and certain other external causes. Then you can specify what is the external cause. Again, for this you can code S series code for fracture, contusion, hemorrhage, or you can code F series code for drugs poisoning. Drug, matlab normal medicinal drug poisoning. Adverse effect, underdose. Suppose lady is having a fever, okay, and doctor will prescribe 2 tablets paracetamol. I'm just giving imaginary. I don't know whether paracetamol is safe for pregnancy or not. I think it is safe. Don't think I am pharmacist, so I know everything. It's been 15 years leaving my career. Okay, so paracetamol, if doctor has given for 2 days, for 2 times, lady is consuming only one, only evening, morning she forgot. Now it will be considered as an underdosing. If she is developing some effect, it will be considered as an underdose of a paracetamol. Okay, that I will tell you what is underdose, what is overdose, what is poisoning, what is adverse effect. We have a separate guideline for that also. Done? Okay, normal delivery, OAT. Lady does not have any complication. Okay, she just came to the hospital. She got labor and she given birth to single healthy baby via normal delivery. Normal, okay, not cesarean. Cesarean means it's a complication. Lady had some complication, that is why they have chosen cesarean. Correct? So here what is that? This is full term. Full
9 months. Okay, almost like a 38 to 40 weeks. Deliver a single healthy infant without any complication antepartum or during the delivery or a postpartum. Postpartum to we'll decide later. During the episodes, OAT is always principal principal diagnosis. Okay, and you cannot code any other chapter 15 code. It's not to be used if any other chapter 15 is needed. We can code Z37 series code for outcome of a delivery here.
चलो सर नेक्स्ट कैंडिडेट विदाउट मिस कोई बात नहीं एक शॉट मार के भी आ जाएगा तो उनको मत बोलना करो नहीं उसको नहीं मेरे
Here in OIT they are saying it is a code which is used for a anti if patient does not have a complication. What if patient had a complication earlier during pregnancy but that is resolved? At the time of a delivery it is not there. The complication is not there. Still you can code OAT. See? Uncomplicated delivery with the resolved antepartum complication. Why they have given guideline? Because see, on the first guideline, they said healthy infant without any complication antepartum. Just to clarify that thing, that if in antepartum before delivery there was some complication which has resolved, maybe patient had a excess vomiting earlier. In the 5th month, 6th month, she has excess vomiting. But that is resolved. At the time of delivery, it is not there. You can code OAT. No problem. Had a complication at some part of the during pregnancy, but the complication is not present at the time of admission. Right? At the time of delivery, it's not there. Yes, you can code Z37 code along with the Z37.0 only. Because 0 is for single live birth. Other Z series code, Z37 series code is for twins. Twins is complication. Twins, one live, one still, that is also complication. Right? Single, stillborn, that is also complication. Okay? So baby should be healthy, single. Then only you can code OAT series code. Postpartum, 6 weeks following delivery, which I told you. It's given here. Peripartum is the last month of a pregnancy to the next 5 months of after delivery. Peripartum, this is one other word which is for the last month of delivery. Today lady delivered a baby, 29th of December. So peripartum period started from the 30th of November. Okay? 1 month previous delivery. And after 5 months of a delivery. So it will be May 29th. Peripartum period will be end. Okay, what if a lady is coming after 2 months? Okay, lady is coming after 2 months of a delivery, which is beyond postpartum period. Postpartum period is a 6 week, 1.5 month only. Suppose lady is coming after 2 months with some complication which started during pregnancy. Can you code O series code? Like nowadays we have a pregnancy induced depression. Okay. Postpartum depression. That is called a postpartum depression. Can we code O series code even after postpartum period? Yes, we can code, but the only situation is when the complication started during postpartum. Okay. If it started after postpartum, we cannot code.
क्या दिक्कत है? मैं लेके जाएगा, मैं लेके आएगा, मेरे साथ जाओगे। अच्छा, पूरा सेफ्टी है, ठीक है?
If a provider document that a condition is pregnancy related,
तुम जाएगा मेरे साथ, तुमको लेके जाएगा रूम का अंदर।
pregnancy related or started in a postpartum.
तुम काम शुरू करेगा, मैं बाद में आएगा बाहर से। कोई भी नहीं आएगा, कोई भी नहीं पूछेगा क्यों आया, किस लिए आया।
Admission for the routine postpartum care. Yes, we do have a code for that. Z39.0.
7,000 लेता है वो ऑनर, मालूम है? उसको पहले से ही बोला है, हमारा कोई भी आए।
Means lady is coming for a follow up after delivery.
रेंट मिलना है, तुमको रेंट।
Doctor call na sometime come after 1 week, 2 week. We'll check all things.
तीन मेला है ना,
Right?
तीन मेला का ऊपर है, छत का ऊपर उसका एक ही रूम है।
Pregnancy induced cardiomyopathy. Cardio means heart.
उसको मालूम है, वो मेरा बीबी है करके।
Myo means muscle. Pathy means disease. Pregnancy induced cardiomyopathy O09.3.
Sir,
Yes.
here Z39.0 is there, no? Encounter for care. First, we have to code that code, then O series code.
If there is any complication, yes, you can code it. But if it is a postpartum, if suppose patient have some postpartum complication, okay, then definitely you can code it. Z39.0 and then any O series code. Sequela of a pregnancy, O94. Sequela, remember, general guideline. Sequela, late effect. Okay, it has no time frame. And the second rule is the acute condition should be resolved. So lady completed his pregnancy 5 years back. Okay, but now she is coming with some complication, and doctor said this is because of your previous 5 years before pregnancy. Okay, this complication is because of your that pregnancy 5 years back. You can code O94. Sequela code. Termination of a pregnancy and spontaneous abortion. Z33.2 encounter for elective termination. Okay. And Z37 outcome of a delivery. Two code we need. O03.4 incomplete spontaneous abortion without complication. Spontaneous automatically अपने आप हो गया abortion. Okay, so but it's incomplete. Baby fetus got aborted automatically, spontaneously, but few traces are still in the uterus. That is incomplete spontaneous abortion. O07.4 failed attempted termination. We tried to abort fetus. We tried to abort fetus, but it was failed. Lady is still pregnant. O07.4. O04.6 is a delayed or excessive hemorrhage after induced termination of a pregnancy. So in such case, you do not code O72.1, which is a hemorrhage pregnancy postpartum. That is not for termination of pregnancy. That is not for abortion. For abortion, O04.6 we have. And the last part is abuse in a pregnant patient. So we have three type of abuse. O9A.3 is a physical, O9A.4 is a sexual, and O9A.5 is a psychological. Good? And the last guideline is for this chapter is COVID-19. If lady is pregnant and lady is a COVID, lady suffering with COVID. 098.5. See, we do not have a proper code for COVID in a pregnancy. That is why we are coding other specified viral disease. And as we do not have a COVID wala code, so we have to code COVID code also, U07.1. If we had a code, if we would have a code for a COVID in pregnancy directly, then you will not code U07.1. But here you don't have. They have not designed yet the code. So 098.5, which is other specified or other viral disease. Which virus? COVID virus. Second code. U07.1. And then you can follow the same COVID wala guideline. Okay, related symptoms, history of COVID with multiple organ dysfunction. Chapter 15 completed. Anyone is carrying a charger? Okay, my battery is on now. Okay. So chapter 15 done. Let me know if you have any doubt. You do one thing. I shared this document with you, right? Already. This PDF. Open the PDF in your phone. Scroll down. Now this is the highlighted one. This highlighted part I will share at the end. Once ICD will finish. Okay. Right now just open that PDF in your phone. Scroll down chapter number 15. Check if you have recall this guideline. Whatever I have highlighted here or not. Do that. Chapter 15 done. If you have any question, welcome. Otherwise, we'll go to the chapter number 9. Good. Those who have book, you can use your book also. Yes, sir. Am I audible now?
Yes, sir.
So now come to hypertension wala guidelines, chapter number 9. Hypertension everyone knows. High BP. Achha, is there any difference between high BP and hypertension? Yes. What is that? High BP. What about? Low is also fine. High BP, hypertension. What is the difference? High BP means your blood pressure is more than usual, right? 120/80 it should be. It is more than any reason. If you are running, you are doing gym, you are doing cardio exercise, definitely your BP will be high. Because your blood needs to be, your blood is forcing high, flowing high with high speed, right? That will induce high BP. Means your blood is pressuring your arteries. That is your blood pressure. Okay. So high BP is sometimes normal also. Because if my BP is high when I'm doing exercise, quite normal. My BP is high when I'm doing little exercise or walking or running or swimming. Fine, it's good. But if I'm sitting here in a chair, still my BP is high. That is not so good. Now this is a hypertension. Continuous high BP. Continue all the time. High BP is known as a hypertension. So we have two codes, one for high BP without hypertension and one is a hypertension. Okay. High BP is a R series code, symptoms code. So hypertension code is a I10. So I will not come on this. I will not this one. Just a minute, guys. I have another document with hypertension. Hypertension code is what? You can remember I10 car. Alien wala I10. Heart disease. Okay. Now, in that also not all heart disease are there. The heart disease whose range, the code range is either I50 or I51.4 to I51.9. These heart disease only can change I10 to I11. Other heart disease can't. Okay? Okay. See this. Hypertension code is I10. Hypertension plus heart disease is a I11. Okay. Now, can all heart disease can change I10 to I11? No. Only few heart disease are related with the hypertension. Which heart disease are related? Which heart disease can change I10 to I11? I50 series code or I51.4 to I51.9 series code. If I say I51.2, that is also heart disease. Can I code I11? No, I will code I10 only. If hypertension is there. Because that is not coming under this range. And how do I know this range and all? You also know, boss. It's here only. If you come HIJ.
ಅದು ಇದು ಸ್ನ್ಯಾಕ್ಸ್ ಇದೆ ನೋಡಿ ಮಗ, ತಿಂತೀಯ? ನಿನ್ನೆ ನೈಟ್ ಡ್ರಿಂಕ್ ಮಾಡಿದೀವ, ನಾನು ಮಲ್ಕೊಂಡಿದ್ದೆ ನಿನ್ನೆ, ಫುಲ್ ಮಾಡಿ ಮಲ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದೆ. ಏನು ಹಂಗೆ ಬಿಡೋದು ಮಗ, ಬೀರು ಒಂದು ದೊಡ್ಡ ಮಲ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದೆ.
Just a minute.
ನಾನು ನಮ್ಮ ಮಹೇಶ್ ಅಂತ ರೂಮ್ನೇ ಇದ್ದ, ಮೊದಲು ಬಿಟ್ಟು ನಾನು ಬಂದಿದ್ದ. ಮತ್ತೆ ಒಂದು ಗ್ಲಾಸ್ ಕೊಡಿ. ನೀನಿದೆಯಲ್ಲ ಮಗ, ನನಗೆ ಬೇಕಂದ್ರೆ ಅವನು ಕೊಡ್ತಾನೆ, ಏನು ಮಾಡ್ತಾನೆ ಮಗ?
See, I11.
ಅವಳು ಬಿಡು ಮಗ, ಸುಮ್ಮನೆ 100-200 ರೂಪಾಯಿ ಯಾಕೆ ಜಗಾಡೋದು?
Hypertensive heart disease. Any condition in I50 or I51.4 to I51.7, I51.89 or 9 due to hypertension. You can see I51 series code if I say
ಇವು ಬೋಳಿ ಮಗ, ನನಗೆ ಅವನು 5500 ಮೇಲೆ ಕೊಡ್ಬೇಕು. 500,000 ಜಗಳ ಯಾಕೆ ಆಡ್ತೀವಿ ಬಿಡಮ್ಮ, ಸುಮ್ಮನೆ 500,000 ರೂಪಾಯಿ ಗೋಸ್ಕರ.
see ventricular fibrillation. This is also heart disease. And atrial premature, 6 sinus syndrome, or if I say I51 point cardiac septal defect. This is also heart disease. No, can this change my I10 to I11? No. I51.0. No. I51.4. From I51.4 to I51.9. This only can change. Good. Similar way, if I want to write, if I have hypertension and CKD in my question, my code will change from I10 to I12.
ಹಂಗೆಲ್ಲ ಮಗ ಇರ್ತೀನಿ ಅಂದ್ರೆ ಈ ಥರ ಎಲ್ಲ ಅಲ್ಲೊಂದು ಪಿ ಜಿ ನೋಡ್ಕೊಂಬಂದೆ ಮಸ್ತ್ ಐತಿ. ಇಲ್ಲ ಹಿಂದ್ಗಡೆ
Good. I10 to it was changed to I12 now. What if my question have hypertension, heart disease and CKD? Can I code I11 and I12 both? No. Here we have a more combo code, I13.
ಎಲ್ಲಿ? ಅಲ್ಲ, ಅಲ್ಲಿ ಹೋಗೋಣ ಒಂದಿನ. ಬೈಕ್ ತೊಗೊಂಡು ನೀನು ಬೈಕ್ ರೈಡ್ ಬರ್ತಲ್ಲ, ಅವಾಗ ಬೈಕ್ ತೊಗೊಂಡು ಹೋಗೋಣ.
Okay. We'll go a little slow on this. It's very important to understand how my code are. So now you got to know how it's going to change from I10 to I11, I12, I13. If it is only heart disease, I11. Heart disease plus hypertension, I11. And we have to code heart disease code separate. Okay. Similar way, if I have a hypertension and CKD, that will be I12 getting, and then CKD code separate. But if hypertension, heart disease, and CKD, all three together, I13. Okay, and then I have to code heart disease, I have to code CKD code separate. Now, I11 is a hypertension plus heart disease. That is not complete code. I11 is not a complete code. We have a I11.0 and I11.9. What is I11.0? I11.0 is a hypertension plus heart failure. See, with heart failure. So heart failure is also heart condition. What is the code range for that? I50. Remember, in I11 I have written here I50 series or I51.4 to I51.9. That will change I10 to I11. Okay. In I11 also we have a bifurcation.
I11.0 and I11.9. So I50 will come to I11.0 and I51.9. I51.4 to I51.9 will come under I11.1. Sorry, I11.9. Yes, it's. Why is not coming overlapping one? This is I11 wala circle. Okay. In that circle, if I want to write down, and it's not happening now. No one know how to write down this. Okay. Just imagine this blue wala circle is a I11 I11.0. Notes, few parts. Add text, where it is? Add text, yes, correct. So this is I11.0. Okay, which is for hypertension plus heart failure. Heart failure code is a I50 series. Okay, but this one, if I'll come, this is I11.9. This is for hypertension. Hypertension plus heart disease. What is a heart disease? Code range is I51.4 to I51.9. 7 or then 8, 9 and 9. So I just say 9 range. Okay? Clear? Similar way, for I12 also I have same thing. And so for I12 we have a CKD. Hypertension plus CKD. How many stage we have CKD?
5.
5 stage, and one last one is a ESRD.
ESRD.
So if I am using I12.9, that says hypertension plus
CKD, stage 1 to 4. Stage 1 to 4 or unspecified stage. Stage. Code range is N18.1 to N18.4 and N18.9. Can you understand what is that N18.1? N18.1 is stage 1, N18.2 is stage 2, N18.3 is stage 3, N18.4 is stage 4, and N18.9 is the 9th stage. Not last. ESRD is also not there. ESRD we have N18.6. It's a unspecified. You can see now. Stage 1 to 4 or unspecified stage. Okay. So unspecified stage will come in as a N18.9. What about the I12.0 then? This have hypertension plus CKD stage 5 or 6. It means N18.5 and N18.6. Clear? So we have 4 diagrams here. This 4 diagrams is clear. One if I want to make a color, find it out. Okay. So I have 4 diagram, 2 circle, 2 rectangle. Okay. Now this circle is for hypertension with heart wala condition, and rectangle is for hypertension with CKD wala condition. Now what if my question have a hypertension, heart disease and CKD? My code will change to I13. Right? Here. How I can combine, how I can decide? Because I11, I12, we have 2 diagrams. I13, we have 4 diagrams. 4 codes. Because you have to combine I11 with the I12.9, I11.0 with I12.0. Similar way, I11.9 with I12.9 and I11.9 with I12.0. You will get 4 combinations. Series. So I13.0, I13.10, 11, 11, I13.0 and I13.2. This is code for hypertensive. Okay, see this. I11.0, use additional code for I11, I50. Okay. I12.0, use additional code for stage, additional code to identify stage N18.5 and 18.6. I12.9, use additional code to identify the stage of the chronic kidney disease, N18.4 to N18.4, 1 to N18.4 and N18.9. Clear? I13.0, hypertension, heart and chronic kidney disease with heart failure and chronic kidney disease stage 1 to 4 or unspecified. Can I say this I13.0 is a combination of I11.0 and I12.9?
Yes, sir.
Say that.
Yes, because it is with heart failure and
Right. So if I'll combine
Yes.
I11.0 and I12.9, I will get I13.0. There I have to
Yes.
use I50 code additional as well as the N18.1 to N18.4 or N18.9 codes also. Similar way, if I'll go to I13.0, this is 13.2. So sorry, I13.2. This is the combination of a I11.0 hypertension heart failure and I12.0 hypertension CKD stage 5 stage 6. Yes. And if it is a heart 11.9, if it will be combined with I12.9 and I12.0, you will get I13.10, I13.11. Okay. Take a moment. If you want to write down, if you want to draw something, please do that. I'm not good in our words as of now. I can draw things, but I need time for that. I don't know the shortcuts and all. Okay. So I can try to draw these things.
Sir, if they ask, the patient is here with a hypertension, heart failure, and chronic kidney disease with the 5th stage. It means that we have to write I13.2, I50, and one of the N series. All the 3 codes has to be there.
Correct. Right.
Okay.
We have to code like that only. ICD question paper. Where is question paper? Practice paper. Okay. See this question. The patient is seen for the evaluation of his continuing unstable angina, which is again ICD score. After significant evaluation, his symptoms were found to be due to atherosclerosis of a bypass graft. This is autologous arterial graft. For that, we have a separate code. CAD of the bypass graft with unstable angina. I'll tell you. Hypertensive congestive heart failure. Now you tell me I11.0, I11.9 or I12.0. What you will code? Forget about the angina code. I25 series, I will tell you later.
I11.
Just see this scenario.
I11.
It's a, do we have CKD here? So I12 is not my answer. So answer D eliminated. Okay, this is congestive heart failure, not heart disease. Heart failure is the I50 series. Along with I50, I50 have a power to change I10 to I11.0. Very good. So B option also cancel. So A or C. Now you have to check. Both options are same. Okay, I did not change the I25 series code. Okay. So A or A and C is correct. I don't have any question. Clear? And remember, you have to code. Yeah. You have to code
I13 series code, can you repeat once again?
Sure. So I13, you have to remember that I13 is a combination of these four things, four diagrams. Right? So if you are combining I11.0 to I12.9, 12.9, first ignore about the blue color diagram, that I11.9. Just ignore it. Now the purple you are combining with red, and purple you are combining with the blue. What you will get? If you are combining purple, you will get I13.0. Okay? If you are combining purple with blue, I11.9, 13.2, I11.0. 11.0 is what? Hypertensive heart failure. Correct. Okay. I11.0 plus I12.0 is equal to I13.2. I have documented here. See, right? I13.2, I11.0 plus I12.0. Stage 5 or 6. But no, if it is not a heart failure, it's a heart disease, I51 series wala code. Okay, then it will come I11.9. So if I am combining I11.9 with I12.0 or I12.9, then I13.10 and 11. Now good. Slowly, don't be in a hurry. If you are getting both options together, I13.10 and 11, no problem. You can come to this page and look at this. No need to read the description also. Just see what is the additional code. If in my question, I got two options, I13.10 and I13.11, then I will just check the stage of a CKD. If stage is a 5 or 6, I13.11. If stage of a CKD is 1 to 4 or 9, I13.10. Right? Just look at that red color. Good now? Okay, so let me come to that guideline wala part. Okay, so here we have in this one hypertension with heart disease. It will come to, okay, what is the color of hypertension then? What I should do? Green? Good now. I50 I50 or I51.4 to I51.7, I51.8, 9 or 9. Okay, the category of the code will be I11 series. These codes are coded separately. This code we can code separately. Hypertension with chronic kidney disease, it's a N18 series. We have to code separate. Hypertension with heart and chronic kidney disease, we have to code I50 if applicable and I12 series code separate. Done. So hypertension guideline done. Still we have some guidelines here. Hypertension guideline clear? Because definitely you will get one question from here. Okay. Hypertensive cerebrovascular disease. What is cerebrovascular?
Brain.
Brain.
In the cerebrovascular. Correct. Disease, cerebro, brain, vascular, vessels of a brain. So if patient have a any disease on the brain blood vessel, which is because of a hypertension. Did you think that why we are changing our code from I10 to I12, I11, and then I11 to I12, I12 to I13? Why they have designed like this? Why we could not code only I10 directly? Right, because we have an interconnection between them. Hypertension. Why hypertension is dangerous condition? This is just high blood pressure. No. Why it is high? Why it is dangerous? Why everyone who have a hypertension they have to take the pills? Because it will lead to some other complication. It will lead to heart disease. It can lead to heart failure. It can lead to the kidney complication. It can lead to the both. It can lead to the cerebrovascular disease also. Okay. So in that condition, you have I60 to I69 series code, and after that you have to go to hypertension code also. So you will go two code here. First cerebrovascular disease followed by appropriate hypertension. This you need to remember, okay? Two code we have to code. Hypertension retinopathy. Hypertension is affecting my retina. X35.06 code. After that should be vascular chain to I15, I10, I11, I12,
Excuse me, sir, your voice is
I15
breaking.
is secondary hypertension. See? Really? Did you ask for repeat?
No, sir, your voice is breaking. We cannot hear.
Not a single thing. Am I audible now?
Yes, sir. Can you please repeat that hypertension retinopathy?
Hypertension retinopathy, X35.0 we have to code along with I series code. Same what we have seen in the cerebrovascular disease. Okay. Then hypertension secondary, what we have seen in our diabetes, right? Different condition. But here it is not specified correctly. But if it is secondary because of some other condition, I15 series we have to code. Here we need to code two codes. Okay. Identifying the underlying etiology, that what is the reason, and from the I15 series. This is the first thing what I asked. This is the thing which I asked you first. What is the difference between high blood pressure and hypertension? R0 3.0 is the high blood pressure code. Elevated blood pressure reading without diagnosis of a hypertension. Controlled, uncontrolled, benign, malignant. This all hypertension is a I10 only. So no problem with control and uncontrolled. Yes, crisis. That is one emergency condition when hypertension is so severe that it is going to affect my organ system, patient's organ system. Okay, so that is known as a hypertensive crisis condition. In that we have a two code, I16.0 and I16.1, urgency and emergency condition. I16.0 urgency, I16.1 emergency, and I16.9. I don't know which type of crisis, but it's a crisis, unspecified. Pulmonary hypertension. What do you mean by pulmonary?
Heart.
Lung. Right? Lung. So if I have a high blood pressure or hypertension on the lungs artery, it's a lifelong condition. It cannot be treated. This is I27 series. Hypertension resistance, I1A.0. That remains above the goal in spite of use of antihypertensive drug. This question I have seen last week. Someone asked me some from exam preparation. They asked me what we can code or how we will get this answer. So they see this. If patient is taking blood medicine, but still he or she has hypertension, then it's known as a hypertension resistance. Code is I1A.0. So 10 minutes and then we are done. Okay. Do you remember medicine chapter? I told you about the coronary this angioplasty, balloon angioplasty, atherectomy, stent placement. The coronary arteries are blocked, right? What is this condition known as? CAD, coronary atherosclerosis disease, or coronary artery disease, or coronary arteriosclerosis. CAD, atherosclerotic coronary artery disease. Angina is a heart pain. Angina have two types, unstable and stable angina. What is an unstable angina? Or stable. First, let's start with the stable angina. These are the symptoms. This is the early symptom of the heart attack. Okay. Heart attack patients in a chest pain. This is not chest pain. This is heart pain actually. That's why it's a crushing pain. Someone is crushing the heart. Okay. And it will radiate to the left side and upper side. This is heart attack. Okay. So angina is a heart pain. In that we have a two portion, stable and unstable. Stable means patient know patient's angina is stable. It means if a patient know that if I'll doing severe stress on the heart, means exercise, emotional. Someone say, "Hey, he just got from heart attack. Don't give him bad news directly." Right? Because we know if we will give a bad news, we will suffer with angina again and one more heart attack. Right? That is a stable angina. We know that we should not give him bad news, or he should not do exercise, he should not do cardio. That is stable angina, which is dangerous. Unstable angina is the more dangerous. Patient is having angina, okay, angina disease earlier. Patient had a heart attack. He's just watching a very comedy movie. By laughing only he died. By laughing he got a heart attack. He's dead. Why? There is no stress in the heart. Still he got angina. That is unstable angina. Very, very dangerous condition. So that is associated. Definitely it is associated with the CAD. Because why patient is getting heart pain? Because blood supply is not properly in a heart muscle. Why it is not supplying? Why it is not correctly supplying? Because we have a blockage in a coronary artery, right? So in such case, you have to code a combo code. See, we have a combo code for angina and coronary atherosclerosis. How you will go? You will lead this code by atherosclerosis, coronary artery. In that also native artery. We have 5 native arteries. 3 on the left, 2 on the right. Right? But then patient, if he had earlier heart-related disease, then he might gone through with the bypass surgery also. Right? So bypass surgery wala code will be separate. So that is why it is differentiated like a atherosclerosis coronary artery native. And then we have a second drop down, bypass graft. So either it will be bypass graft or native. But in your question, it is not documented clearly. So if it is not documented bypass, it is native. For bypass, they should document bypass. For native, no need. It will be native. Okay. So atherosclerosis, coronary artery, native vessels with angina, unstable. This documentation already I have shared with you. Check this one. Sequela of cerebrovascular disease, brain stroke. What can be sequela of brain stroke? If patient got stroke, either he will die, right? Brain stroke. Brain blood vessel is blocked. It means our brain is not getting proper blood supply. What will happen? Correct. Paralysis. Right? That would be considered as a sequela effect of a cerebrovascular disease. Why so sequela? Because today patient got cerebrovascular attack. Okay, brain stroke. He got paralysis. We treated him for the stroke. Now after 6 months he is coming hospital again. Not for stroke. Stroke is already gone. Is cleared. Is treated. Now he is coming for this paralysis treatment. So paralysis will be considered as a late effect of a cerebrovascular disease. Correct? Good. So paralysis again is a different type. Patient have only one extremity paralysis, both extremity paralysis, upper or lower, right? All 4 extremity paralysis, one side paralysis. Okay. So hemiparesis, paraparesis, quadriparesis, that are the terms for the paralysis. Hemiparesis means one side, right side paralysis, right arm and right leg. Monoparesis, only one extremity. Paraparesis, upper or lower. Quadriparesis, upper and lower. Okay, so we have a guideline for dominant, non-dominant side. So I will explain this dominant, non-dominant and G series. There also we have same guideline, exact same. So I will refer this portion. Okay, in a G series guideline. That what you call a dominant side. What is your dominant side? If I throw a ball suddenly to you, which hand you will stop?
Right hand.
Right hand, because you are right dominant people. Some people use left hand for all the purpose. They will use left hand, right? Left dominant. So I will give you the guideline. I will explain you the guideline for that. If paralysis has been occurred in a dominant side, then what we will code? Non-dominant side, what we will code? Right? Okay. Let's come to acute myocardial infarction. What is that disease? What is this one? Every one of you know this. What is this AMI? Okay. General language.
Heart attack.
Heart attack. This is a this clinical name of the heart attack. AMI, acute myocardial infarction. Okay. It has a multiple types of MI we have. The one category is a STMI and NSTMI. You remember in ECG I have shown you the one peak, PQRST. Okay. So if that patient is coming with the MI, first thing they will do ECG. Very first thing is a ECG. They have to do after giving anticoagulant. Okay, that they want to find out whether it's a STMI or NSTMI. If ST is peak is elevated, then it's a ST elevated myocardial infarction. STEMI. ST elevated myocardial infarction. STEMI is a non-ST elevated myocardial infarction. STEMI, non-STEMI. Okay? Which is more dangerous? Both is dangerous, yes, correct. More. STEMI. STEMI is more dangerous. Okay? So we have a guideline for this. See, if a STEMI evolves to NSTEMI evolves to STEMI, patient, first we got to know we did ECG just now. It's a STEMI. After 1 hour we did. It's a STEMI. First we did is the NSTEMI. We did ECG in a first ECG shows is a NSTEMI. After 1 hour we did again one ECG. It is saying STEMI. What you will quote today? Both or only one?
The second one.
You will quote STEMI.
Yes.
What if patient is coming with STEMI, but we did some therapy and now it's an NSTEMI?
Still, we have to quote STEMI because the patient was
correct. We have to quote STEMI that also because STEMI is a more dangerous. Okay. This is one guideline. Okay, now come to very interesting guideline. That would be the last guideline for this chapter. Okay, that is a 4-week guideline of a STEMI of MI, not STEMI, not only STEMI, not only NSTEMI, but all the MI, whether it's a type 1, type 2, STEMI, and NSTEMI, anything. We follow 4-week guideline. Patient suffered with the heart attack on the 1st of December. Okay. He got admitted in a hospital. In the 7th or 10th December, he got relieved. Because he is doing good. Still, he is getting treatment. He will get treatment for 4 weeks at least. Because clinically, it will take 4 weeks to resolve one MI. Okay. So till 28th of December, you will still code MI. That to active MI. Okay. Till 4th of December, till 4 week, 28th of December, you will be coding active MI. Then what about after 28 days? After 4 weeks? Even after 4 weeks, patient is getting treatment. Then you will code after care code. And if patient is not getting treatment, you will code I-25.2 old MI code. today it's like 12:29. Okay. For MI, you will code I-21.9, that is unspecified MI. I can code same code for the next 28 days, believing patient is taking active treatment. With 4 weeks, if patient got another MI, this one, what happened within 28 days? Patient got another MI. Already I am coding first MI as an active. Right? Now patient got second MI. Second heart attack. So this is subsequent MI you have to code. See? Subsequent MI category I-22 category. Good. So this is what when we can code subsequent MI. Subsequent MI we can code when patient got one MI and within 28 days. That is not the same day. Within 28 days, if patient receives another MI, it's a subsequent. Second one will be known as a subsequent and first one is the first one. For encounter occurring while the myocardial infarction is equal to or less than 4 weeks old, including transfer of another acute setting to the post-acute setting, and the myocardial infarction meets the definition for the other diagnosis. Category I-21 may continue to report. See, continue to report till the 28 days. For encounter after 4-week time frame, the patient is still receiving care related to myocardial infarction. Appropriate aftercare code should be assigned. And if it is not receiving after receiving care, then old MI we can code. Good. Now we don't have any guideline here. They are talking about what I will code acute MI unspecified. We have a I-21.9 code. If it is not specified, STEMI and STEMI type 1, type 1A, type 1B, no then I-21.9. If an AMI is documented as a non-transmural or subendocardial, but the site is provided, it is still coded as a subendocardial AMI. That is okay. Subsequent MI, see, 22 category subsequent MI and non-ST elevated myocardial infarction is to be used when the patient who suffered type 1 or unspecified AMI has a new AMI within 4 weeks time frame of an initial AMI. A code from category I-22 must be used in conjunction with the category I-21. It means you have to code two codes, I-21 and I-22, which I have documented in the last line. Here, two codes you will code. Do not assign I-22 for a subsequent MI other than type 1 or type or unspecified. Okay, this one we can see. For subsequent type 2 AMI assign only code I-21.A1. Okay. For subsequent type 4 or 5 AMI assign I-21.A9. So subsequent is only and only for unspecified or type 1. If a subsequent MI of one type occurs within 4 weeks of a myocardial infarction of a different type, Assign the appropriate code from the I-21 to identify each type. Do not assign I-22 code. So subsequent MI is only and only for type 1 and unspecified. Other type of myocardial infarctions, so there's no guideline, it's just a code they are saying. I-21.0 to I-21.4, type 2 we have, okay, and undergoing causes if applicable. It's just a acute myocardial type 3, 4, 4A, 4B, 4C, 5. These all are a type of a MI. So you have to follow the tabular guideline. Code first, use additional. The last one is a myocardial infarction with a coronary microvascular dysfunction. CMD is a condition that impacts the microvasculature by restricting microvascular flow and increasing microvascular resistance. Code I-21B, combo code. MI with coronary microvascular dysfunction. We can code. This is the biggest topic, no? Important also. Chalo, please check. Let me know if you have any doubt on the chapter number 9. One more class I will need for ICD. Now we have all small topics, 15 minute chapters only. Like what we have done yesterday, skin wala system L97 series. Similarly, I have what is that? H series code, G series code, GH, J, P, yes, GH, J, K though I don't have, we don't have L already done. M, N, P, Q, R, S, STUV. But that is not big topic, okay? That is very small topic. The only one thing is the injury part. I have to tell you, burn course, burns and injury. That I will tell you tricks only, how to solve that. So one more class for 2.5 or 3 hours, it will be done. So revise it first. Let me know if you have any doubt. Then let's see. Continue on. Before next class, and start solving questions on that. These questions means the question papers. J does not have any such guideline. We just have a codes there. Okay, done then? Done for the day? Chalo, done for the day. 3 o'clock. Okay. See you tomorrow. Not tomorrow. Next week, Saturday we will end this ICD. Will not take much. It's already 4 class, no? It's only 5 class. I always plan. Okay. So see you next week.